the demographics of CFS, well-known, young people, mid-40s, for women to men, no other diseases, and suddenly they become ill. Following my own experience, I began to get Holter monitors on people who were tired. And as a matter of fact, when the heart worked, when the heart rate increased, the electrocardiogram became abnormal, and regularly, you can see these inverted T waves look very much like coronary artery disease. Multiple studies show that there is no coronary artery disease in these people. And this is even more exciting, the remarkable ST segment depression in this young woman whom we saw in our office. And several studies were done. The first one was done when my office manager took 300 Holter monitors from my office, and I read them blindly and read them along with about 30 or 40 patients with CFS, and noticed that there was a remarkable difference in the abnormality of the Holter monitor among patients with the chronic fatigue syndrome. The next thing that we did was ask Dr. Korotkin and Dr. Brodsky to read these studies along with controls from their office, done blindly, with my having nothing to do with it at all. I must say that Mark and Steve were very reluctant to expect anything, and the results were exactly the same as the first. And as a matter of fact, the sensitivity, these are studies that are published, and there are now a dozen peer-reviewed papers to support the things that we've said. The sensitivity of the Holter monitor is 0.96, and the absence of these findings in a patient with fatigue makes it highly unlikely that that fatigue patient has the chronic fatigue syndrome. All of you know that the heart is a beautiful architectural structure made of syncytia, and these syncytia pull together in a most conserving way. And the regularity of the syncytia is extraordinarily helpful. This is the sign. This is one of our patients. The blue, this is all the result of apoptosis with myofiber dropout and fibrous replacement. Fat should never be in the heart. And these myofibers are in total disarray. This is done by, along with Dr. Chang of our department of pathology. We wondered, and I was fortunate to have Sayo Bijak. We saw patients with Epstein-Barr virus and chronic fatigue syndrome, and had patients with what is called antibody to early antigen. The antibody to early antigen is an array of gene products to the first 20 of the 200 of the gene products that put together the virus. And there are patients who have elevated early antibody and are well, and there also are patients who have elevated early antibody who have the chronic fatigue syndrome. But at any rate, and this will become clearer as we go along, Sayo looked for an early antigen that we could find for cytomegalovirus. And he was able to negotiate with a company called Diasorin, which has an Italian base. And we were able to get early gene products, molecular, biologically produced, for cytomegalovirus from genes which were very close to the DNA polymerase of the virus, UL44 and UL57. And we were able to use these And SIO did all of these assays. Of course, there was no charge to patients. This is the crude virus lysate that we all get from when we ask for this assay anywhere. And this is an antigen which is purified just by sucrose density centrifugation. This was P52, UL44, and this is CM2, which is a recombinant protein antigen of UL44 and UL57. Incidentally, these two antigens are highly useful in pregnant women who have primary cytomegalovirus infection during the first phase of pregnancy. And they're highly specific. And this was an amazing study that we did and is published. There are this is CM2, this is P52. The positives are in the clear areas, and it's remarkable these positives occurred in patients with CFS alone. Much of this I've already paraphrased for you. Patients are looked at. They meet the CDC criteria. They have the appropriate antibodies that we've looked at, and they are treated with pharmacokinetic valacyclovir, which is Valtrex, in a dosage high enough to be higher than the IC50 for EBV through 80% of the times of the day. And this amounts to, for a 70 kilogram individual, 14.5 milligrams per kilogram, or 1 gram every 6 hours. When we did this, we of course went through the Human Investigation Committee here. We ultimately got a grant from GlaxoWellcome. We got approval from the FDA. The danger of this is that at this level of Valtrex, which is merely a valine, which with an acyclovir with an esterified valine attached, will form kidney stones. So one needs to drink at least 6 8-ounce glasses of water with this. And we ultimately did a placebo-controlled trial and carried on after this. In order to evaluate patients, it was obvious that we had to have a more finite means other than how fatigued one is. One can do this by measuring the kilocalories per day that are expended. One can also do this by determining what in the world does the patient do. And very early, Bob Dieter of GlaxoWellcome and I copyrighted what we call the energy index point score. This energy index point score has now been validated with a score that's used to measure fatigue called the fatigue severity score, and this was validated statistically. Up until 5, you fit the CDC criteria. From 0 to 5, you can be out of bed, none, a little bit, et cetera, et cetera. At 6, one still needs to lie down every day. 7, no naps. 8, one can begin to exercise. And 9 and 10, one's normal. It has been our goal, of course, that our patients exercise. But we don't exercise these hearts until they're up to 7 or 8.